Hi, this is Dr. Bob Dannenhoffer, the Public Health Officer for Douglas County, with another of our briefings today for October 13th, 2022. We're now 2.5 years into this pandemic, and we've got good news, but a little bit of worrisome news on the horizon. Again, if you have questions, please send them to us at Facebook questions at douglaspublichealthnetwork.org. We were to have a guest today from the state immunization program, but their kids got sick, which is one of those things that's happening. And so I'll try and tell you a little bit about the immunization program. If you have questions, send them to us at Facebook questions at douglaspublichealthnetwork.org. So in the state of COVID, things are going pretty well. Throughout the world, the number of cases is decreasing. In the U.S., the number of cases continues to decrease. And in Oregon, we're having a pretty quiet time of it. In Douglas County, we're down to about 10 or 20 cases a day that we know about. There are obviously more about there that we don't know about, but the number of hospitalizations is really quite low. We've been having 2 to 8 people a day in the hospital and still an occasional death. And the thing that is striking is that those who get hospitalized and those who die are overwhelmingly among people who've never had any contact with the disease before. So these are people who never got immunized, never even a single vaccine, and never had the disease before. And then when they get it, they get really sick and they die. So the COVID that's out there is not a milder form. It is more contagious than the original forms. It's still pretty deadly if you've never had experience with it. But most of us have had experience with it, either through vaccination or through infection or through both. But for those who've never had exposure to it, it's still a fairly deadly disease. So our real hope is that for those people who were hesitant about the vaccine early on or wanted to check to see, didn't want to be first, you certainly won't be first anymore. And if you get a vaccine, we know you can decrease your risk of getting hospitalized and dying, and also decrease your risk of long COVID. And that's our question later for today. What about long COVID? So now that we're 2.5 years into it, what we're getting to see is that those people who had long COVID, that is that they have symptoms of tiredness, fatigue, chest pain, loss of taste, are for the most part getting better. And so that is a really good sign. So we looked at our original 20 people who had COVID, and about half of them had symptoms 6 months later. However, when we check them now later, most of them have recovered. So the biggest side effects were this sense of chest tightness and fatigue. So people were saying, geez, I'm just not able to do nearly what I was able to do before. I'm still more sleepy, just feel more tired and more fatigued. And the good news is if we follow those people out, those symptoms generally resolve. Now, the bad news is it's taken a long time. So for some people, it's taken over a year to resolve. And so that we do worry about long COVID. We've not seen any magic treatment for it. There was some suggestion that if you'd had long COVID, getting a vaccine after you had long COVID might help. Probably if it does, it's only minimally, and it really just seems to be time that makes it better. And I will tell you, in my pediatric practice, we've seen a lot of kids who had COVID, didn't have a very mild illness, but were actually more sick after they had the disease than during it. And afterwards, it's usually fatigue and shortness of breath. And especially for our athletes, we measure their oxygen levels. It's normal. We do chest x-rays. They're normal. We do breathing tests. So they're all normal. But yes, it's this subjective sensation that something's sitting on their chest and making it hard for them to get either a deep breath or to get the air all the way out. The good news is the vaccine's out there. And so the bivalent vaccine we've been given now for over a month. The bivalent vaccine seems to be really very safe. We've been very carefully monitoring for side effects of this vaccine, and we just have seen nothing more than those things that we originally anticipated. That is the pain and the discomfort after the injection. Some people get a little bit of tiredness that goes away in a day or two, but the longer term things that we've been really carefully monitoring, such as the blood clots that were there with the J&J, have not seen that with the Moderna or the Pfizer, or the myocarditis. Again, there are going to be some people get a little bit of heart inflammation from the vaccine, but you're far more likely to get the heart inflammation from the disease than from the vaccine. So the vaccine's out there. We're having our clinic today and tomorrow out on Diamond Lake from 1 until 6. It's really quick. I got mine there 2 weeks ago. It was just quick run through and get it done. In addition, most of the clinics and the pharmacies also have some COVID booster. One of the other questions we got this week was, what's this thing in Florida? So they put out a report in Florida, and I can tell you, it's hard to make heads or tails of it. It's not very well described what's going on. There's no way to double check the data, so I don't know. But this report reported that there was an increase in cardiovascular mortality for young people after the vaccine came out. And again, it's hard to know. Now, the way science works is that you get a hunch, like, I wonder if this thing causes something or other. And then you look at the data and you carefully scrub the data and go through and see if you can actually find that difference. It turns out that most hunches are wrong. So about 90% of the time when you look at something and you look at a hunch, it turns out not to be right. You say, it seems like every Tuesday it rains. And then you look and you see, and it says, yeah, it looks like it rains every Tuesday. But then when you go back over a year, it rains on all days, and it's not just Tuesdays. And so that hunch that you had that there might be something going on about Tuesday rain turns out to be just a hunch. And so that's how we do science. So again, you could cherry pick data of a time we have an increased mortality, but then you need to go back and say, well, is this replicated in other times? Were the people who died actually people got the vaccine? And I think when you look at it, most of these hunches have not played out. But the deal is that in science, usually what happens is people do these, they submit this for peer review. The peer reviewer will say, well, it's interesting that there was an increased mortality during this one little time frame. Did you look over a longer time frame? And that kind of thing apparently has not happened with that Florida study. The other thing that we're worrying about is wildfire smoke. I drove through Oak Ridge the other day, and the wildfire smoke is just awful. Their air quality index was over 500. With an air quality index over 500, even people with normal breathing systems really can wind up with tremendous respiratory symptoms. So I just drove through, and I was in my car with the air conditioning on. And even with that, I was coughing afterwards. So you can imagine people who are at high risk for respiratory disease, that is the people who are very young, people who are very old, or people with underlying conditions like COPD or asthma. So we really do worry about that. Our recommendations, if you're in an area where there's high smoke, if you can get out of the area, please do it. If you can't get out of the area, staying in the house with an air cleaner will certainly decrease the amount of particulates that you breathe in. So overall, the news on COVID is good. We do expect a little bit of an increase in disease in November, December. I think we're already starting to see that in Europe, and we do expect a moderate flu season. And the concern that we have is that with a moderate flu season and a little bit of COVID, we could have another big stress on our hospitals. Our hospitals are already quite full. I looked yesterday at the hospital status. There were no ICU beds in our region. So no open ICU beds in our region, which means that if I get sick or you get sick with something even unrelated to COVID, our hospitals are really stressed. So our goal at this point has to be really to protect our hospitals from getting overloaded. So best advice, stay home if you're sick. If you do get sick, please get tested for both flu and COVID, because we know there's a little bit of flu in Oregon. If you're positive, talk to your doctor about getting an antiviral med. Again, the antiviral meds have seemed to be very effective. Of all of our recent deaths, none have taken advantage of the oral antiviral meds, which work so well. So again, if you get sick, get tested for both COVID and flu. If you're positive, talk to your doctor about getting an antiviral med and stay home for 5 days. Now, the new variants that are out there are not contagious for long periods. So if you've got it, 5 days has elapsed, you're afebrile and starting to feel a little bit better, you can go back to work or other activities. Again, this is Dr. Bob Dannenhoffer, the Public Health Officer, Douglas County. Thank you.